A certificate says you learned something. A project proves you can do it. And that's the difference between a CV that gets ignored and one that gets a reply. In the last video, I gave you the full roadmap into healthcare data. Today, we go deep on the part that actually gets you hired with zero experience, your portfolio. I'll give you 5 specific projects, the exact questions to answer, the free data sets to use, and the skill each one proves to an employer. Pick 2 or 3, build them well, and you'll out-apply people with years more experience. Let's go. Before the projects, one rule, because most beginner portfolios get this wrong. A project isn't a chart. It's an answer to a question a healthcare employer actually cares about. Anyone can plot a data set. What gets you hired is showing you can take messy health data, ask a real question, and turn it into something a busy manager can act on in 5 seconds. So, for every project on this list, you'll do 3 things. State the question, find the insight, and spell out the so what. What should someone do differently because of what you found? Keep that structure in your head for all 5. It's the thread that turns 5 technical exercises into 5 reasons to hire you. And the good news? Healthcare hands you the raw material for free. Every data set I'm about to name is public and open. Let's build. Project 1, the one that signals I get healthcare louder than any other. A hospital readmissions dashboard. The question: which patients are most likely to come back within 30 days, and why? Readmissions cost health systems a fortune and are watched closely everywhere, so this is a problem employers feel. Grab a public readmissions data set. The diabetes hospital readmission set on Kaggle is a perfect starter, and build a dashboard in Power BI, Tableau, or Looker Studio. Show the overall readmission rate, then break it down by age, by length of stay, by number of prior visits. The so what writes itself. Here's the group most at risk. Here's who to follow up with first. That single sentence is what a hiring manager remembers. Project 2 flexes a different muscle, SQL and storytelling over time. The question: how has a condition changed over the years? And is it the same everywhere? Pick something with real public stakes. Diabetes prevalence, smoking rates, overdose deaths, vaccination coverage. CDC Wonder and the WHO Global Health Observatory give you decades of this, free, by year, region, and age group. Use SQL to aggregate it, group by year, by region, then chart the trend and the geographic spread. The insight that lands isn't rates changed. It's rates fell overall, but quietly rose in these specific places. The kind of finding that changes where a health system spends its money. That's analysis, not just a graph. Project 3 is pure operational gold because it mirrors a problem health systems fight every single day: emergency department waiting times. The question: what drives long waits? And when do they happen? This one shows you can think like an operations analyst, not just a data one. NHS England publishes A&E attendance and waiting time data openly, even if you're not in the UK. It's a brilliant, realistic operational data set. Analyze waits by time of day of week, by department. Find the bottleneck. Land it with a staffing or capacity recommendation. When you can say, here's exactly when the system breaks and what to do about it, you stop sounding like a student and start sounding like a hire. Project 4 proves something employers quietly test for. Can you handle big, messy data without falling over? The question: where does the money go? And does prescribing vary by region? Medication data is enormous and gloriously messy, which is exactly why doing it well stands out. NHS open prescribing data and the US Medicare Part D set run to millions of rows. Clean it, join it, then surface the story. Which drug categories drive the most cost and how regions differ? A cost-saving recommendation backed by data you wrangled at scale is one of the most employable things in your whole portfolio. It says, "Give me your real data, I won't flinch." Project 5 is the clever one. It shows you understand the single biggest thing about healthcare data: privacy. Real patient records are locked down for good reason, which is why beginners never get to practice on them. The workaround that impresses people who know the field? It is synthetic data. Synthea generates realistic but completely fake patient histories. No real person, zero privacy risk. Build an analysis on it that you could never safely do on real data. Track a chronic disease cohort, find gaps in care, model a patient pathway. This is the project that makes an experienced hiring manager nod. It says you understand that healthcare data is different, that privacy is non-negotiable, and that you know how to work around it like a professional. Almost no beginner does this. Be the one who does. A quick but crucial bit: a great project hidden on your laptop gets you nothing. Write each one up the same way: the question, the data, your headline insight, the so what, and the tools you used. 5 short sections. Then put it where people look: GitHub, a LinkedIn breakdown, or a simple analyst profile that holds everything in one place, such as Health Data Analysts. If you don't want to build a website just to show 3 projects, then Health Data Analyst Directory is built for exactly this. Host your profile and portfolio in one place. Link is in description below. One honest warning: don't try to build all 5 at once and burn out. Pick 2 or 3 that play to your strengths and make them genuinely good. Clear questions, clean write-ups, real so whats. 3 strong projects beat 5 half-finished ones every time. Depth signals you can finish things. That matters more than range. To make this easy, I've put all 5 into a free project starter pack: a 1-page brief for each project, direct links to every dataset, and the write-up template I just showed you. It's completely free. Grab it from the link in the description. If this gave you a plan, subscribe. Next time, I'm breaking down the exact tools that let you tailor your CV and applications to each role in minutes instead of hours. Build 1 project this week. That's the whole game. See you in the next one.